Welcome. Today we're diving deep into a specific type of heart disease called pulmonary stenosis. This condition affects blood flow from the heart to the lungs, and understanding it is crucial for both those living with it and those seeking to learn more about cardiovascular health. Pulmonary stenosis at its core involves a narrowing of the pulmonary valve. This valve sits between the right ventricle of the heart and the pulmonary artery, the main blood vessel carrying blood to the lungs. In most cases, pulmonary stenosis is a congenital heart defect, meaning it's present at birth. Genetic factors can play a role, and sometimes it's associated with other genetic syndromes, such as Noonan syndrome. While less common, it can rarely develop later in life due to conditions like rheumatic fever or carcinoid syndrome, but these acquired forms are much rarer than the congenital type. To understand the impact of pulmonary stenosis, let's consider the normal flow of blood. The right ventricle pumps blood through the pulmonary valve and into the pulmonary artery, which then branches into the lungs where the blood picks up oxygen. When the pulmonary valve is narrowed, the right ventricle has to work much harder to pump blood through that obstruction. This increased workload can lead to thickening of the right ventricular muscle, a condition called right ventricular hypertrophy. Over time, if the stenosis is severe, the right ventricle may become weakened and unable to pump blood effectively, potentially leading to heart failure. Pulmonary stenosis affects individuals worldwide, but since it is congenital, the overall prevalence is really low compared to acquired heart conditions. Exact figures vary between studies, but estimates suggest it occurs in roughly 8 to 12% of all congenital heart defects. It's important to note that the severity of pulmonary stenosis varies, with some cases being so mild they don't require treatment, while others are severe and need immediate intervention. Studies do not suggest a significant difference in occurrence among different sex or ethnicity. The signs and symptoms of pulmonary stenosis depend greatly on the severity of the narrowing. Mild cases might not cause any noticeable symptoms at all. However, more severe cases can present with a heart murmur, detected during a routine physical exam. Children may experience fatigue, shortness of breath, especially during exertion, and cyanosis, a bluish tint to the skin, particularly around the lips and fingertips. In adults, symptoms can also include chest pain, dizziness, and fainting during physical activity. Infants with severe pulmonary stenosis might exhibit poor feeding, failure to thrive, and significant cyanosis. Diagnosing pulmonary stenosis typically begins with a physical exam where a doctor listens for a heart murmur. If a murmur is detected, further testing is usually performed. An echocardiogram, which uses ultrasound waves to create images of the heart, is the primary diagnostic tool. It allows doctors to visualize the pulmonary valve, measure the pressure gradient across the valve, and assess the size and function of the right ventricle. Other tests, like an electrocardiogram (ECG) to measure the heart's electrical activity and a chest X-ray to evaluate the size and shape of the heart and lungs, can provide additional information. Cardiac catheterization, an invasive procedure, is sometimes necessary to get more precise pressure measurements and assess the anatomy of the pulmonary artery. Pulmonary stenosis can be classified based on the severity of the obstruction. Mild pulmonary stenosis often causes no symptoms and doesn't require treatment. Moderate pulmonary stenosis may cause some symptoms during exertion. Severe pulmonary stenosis significantly restricts blood flow and usually requires intervention. The valve narrowing can also be characterized by its location or type. It may be valvular at the valve itself, subvalvular below the valve, or supravalvular above the valve. The most common type is valvular pulmonary stenosis. Treatment for pulmonary stenosis depends on the severity of the condition. Mild cases often require no treatment, only regular monitoring with echocardiograms. Moderate to severe cases typically require intervention. The most common procedure is balloon valvuloplasty. In this procedure, a thin, flexible tube called a catheter is inserted into a blood vessel and guided to the pulmonary valve. A balloon at the tip of the catheter is then inflated to widen the narrowed valve opening. In some cases, particularly when the valve is severely deformed or other heart defects are present, open heart surgery may be necessary to repair or replace the pulmonary valve. Medications, such as diuretics, may be used to manage symptoms of heart failure if it develops. Since most cases of pulmonary stenosis are congenital, primary prevention isn't generally possible. However, proper prenatal care, including avoiding alcohol and certain medications during pregnancy, can reduce the risk of congenital heart defects overall. For individuals with pulmonary stenosis, preventing complications involves regular follow-up with a cardiologist, adhering to prescribed medications, and maintaining a healthy lifestyle. Prophylactic antibiotics may be recommended before dental procedures in some cases to prevent endocarditis, an infection of the heart valves. The prognosis for individuals with pulmonary stenosis is generally good, especially with timely diagnosis and treatment. Mild cases often have no long-term effects. Balloon valvuloplasty is usually very effective in relieving the obstruction in moderate to severe cases. However, some individuals may require repeat procedures or valve replacement later in life. Recent research is focusing on improving the long-term outcomes of balloon valvuloplasty and developing less invasive methods for valve repair and replacement. Additionally, genetic studies are ongoing to better understand the causes of congenital heart defects like pulmonary stenosis, which could lead to improved prevention strategies in the future.